Welcome. I'm Ferris Taylor from the Healthcare Executive Group, and we want to thank one of our sponsor technology partners, Surescripts, for joining us today to discuss price transparency and the patient experience. This is a quick pivot that we and many in the industry have done this week to create a virtual 2020 sort of HIMSS discussion. And I'm pleased to have with me today Dr. Andrew Mellon from Surescripts. He's the Chief Medical Information Officer there, and I'll let you, Dr. Mellon, introduce yourself. And more importantly, maybe we talk for just a minute. You and I were going to be together in Orlando. What would the listeners have heard about Surescripts and who you are, and how are you participating in other virtual HIMSS experiences right now?
Sure. Well, thank you for hosting us today, and it's great to be here. So again, I'm Andrew Mellon. I am the Chief Medical Information Officer here at Surescripts. By background, I'm a physician in internal medicine, worked for about 15 years part-time as a hospitalist, but really spent 20 years of my career in healthcare information technology, working at health systems, vendors, and a number of different solutions with the EHRs, population health, and other areas. So it's really exciting to be here at Surescripts, and I do wish, and I know many of us wish, we had been at HIMSS this week, but we had a lot we were going to talk about. For those of you that aren't familiar with Surescripts, we are the nation's largest health information network, built to transform interactions between clinicians, pharmacists, and patients. And our purpose is to serve the nation with the single most trusted and capable health information network, built to increase patient safety, lower costs, and ensure quality care. I think it's, taking those words and putting numbers behind it, I think gives you a sense of the scale of Surescripts. Over a course of a year, we handle about 19 billion transactions for more than 314 million patients in the United States. And that's serving more than 1.78 million healthcare professionals and organizations. So, we are behind the scenes on many, many different interactions. Physicians, pharmacy benefit managers, payers, pharmacies have every single day.
That is wonderful. And Dr. Mellon, I personally experienced with my wife in a medical encounter just a few weeks ago, and this is very minor compared to everything that Surescripts is doing, but she carries this list of handwritten medications and what's been crossed off and what's been added on. And we went to a surgeon, and lo and behold, he had the whole list of everything that had been prescribed to her, and she could say, no, the doctor took that one off, this one's current. It was a very different patient experience. And as a gold sponsor partner with HCEG, you are aware of the top 10 issues. And I probably should tell our listeners that HCEG is a national network of primarily technology and information officers in both providers and health plans around the country. And we're celebrating our 32nd year in working together to improve and reshape healthcare. And we discuss and debate critical issues and challenges and opportunities throughout the year, and then formally vote each year and rank an HCEG top 10. And that's a list of priorities. And the listeners will be able to see these top 10 issues on the screen as we go through this. But for Surescripts, we know that number one on that list is cost and transparency, and number two is the consumer experience, and a little further down is interoperability and consumer access to data and like that. And I know that those three in particular are critical issues for Surescripts, and you focused on those. So the question would be, what is Surescripts doing in especially those two or three areas, and how are you going about doing it?
Sure. So when I look at your top 10 list and your network's top 10 list, I think about literally every single thing on there pretty much every day. But I do want to focus on the ones that you mentioned. First with cost and transparency, we know how much patients and physicians are struggling with the cost of medications. As costs go up, it's harder for patients to pick them up at the pharmacy. Study after study shows the cost of medication is directly correlated with adherence. The higher the cost, the lower the adherence. And it's a really frustrating experience for the physician and the patient when after that patient encounter, they show up at the pharmacy and the pharmacist says, hey, that's $200. And as a patient, you may be frustrated about having to pay that much money, or you may be having to make a really challenging choice of getting that medication or potentially a meal or something for your child. So what's been a struggle in the past is that transparency aspect. As a physician, there are often many different choices of medications that can effectively treat a patient, but it wasn't always clear what the least expensive option was for that patient. So we now have an ability for physicians to see at the point of care the cost of the medication they're prescribing. So over 250,000 physicians have access to this today at their point of care. And here's how it works. As that physician is having an encounter in that exam room with the patient, the physician starts to prescribe their medication of choice. But as soon as they put in enough information, the drug, the dose, the quantity dispensed, et cetera, Surescripts, in conjunction with our network, returns a specific price for that prescription. It's not a guess, but it's actually using the same rules that the PBMs use, because the PBMs and the insurance companies are the ones that are actually calculating this, to give that physician that price for the prescription. But if it was only the price, that would only be helpful. You would at least have an estimate or an idea of what you're going to pay. But what you also get back in that is alternatives. So you get a chance to see as a physician options that may have the exact same clinical effectiveness that could be significantly lower cost. This could be a drug in a different therapeutic class. This could even be switching from a 30-day to a 90-day fill, or moving from a retail pharmacy to a way you can take advantage of your mail order benefit. So all these different ways give providers information they never had before to actually make a decision that incorporates the economic impact for that patient. And that's important for so many reasons. We in fact just published a study of about 1,000 patients who talked about price conversations and the importance of medication cost. And I think one of the stats in here just jumped out at me. And we asked patients, how many times have you had to skip a medication because it was too expensive? So, as a physician, here's how I think about that. I've just been in the exam room with a patient. I've had a discussion. We've put together a plan. We're thinking about how we're going to restore that patient's health or maintain their health. And then the result was 53% of the time, patients said they have not taken a medication because it was too expensive. I mean, that's remarkable and scary. And so I think, and what we're seeing is with this tool, physicians are able to make better decisions with patients to, to lower that cost of a medication and have those discussions before they show up at the pharmacy. And I'll just share, one sort of HIMSS or virtual HIMSS moment. So yesterday or earlier this week, I hosted a conversation with Dr. Michelle Forbes, who's a practicing pediatrician, and she uses this tool in her practice. And what I really enjoyed about how she talked about this was a few things. One was she says she's getting a lot less phone calls from angry parents or frustrated parents who show up at the pharmacy and are can't afford the medication she just afford. Those calls have really diminished or gone away. Yeah, the second thing that that she talked about was how she is having those conversations every single patient now. So in the past she would kind of wait for a patient to bring it up, and honestly that's what's happening in most practices. But with this tool, she's changed her workflow to now ask every single time, in her own words, how patients are they struggling with affording their medications. And I think the third thing that really struck me, and I've heard this from other physicians, is how she engages a patient in a shared decision-making process. So she'll actually show the patient the EHR screen with the different options and have a conversation with them about what's the best choice for them. So, that recording will be available on the Surescripts website. We'll have links to that the end of this conversation. But I love the way that she incorporated this, and as she described it, it's a win for the patient, it's a win for her staff, they're getting less phone calls, it's a win for the pharmacies, they're not doing rework, and it's a win for her. She's making the best decision the very first time.
And and we will have the links to that. I did listen in on that webinar, Dr. Mellon, and was really impressed. I will also say, and I didn't want to be throwing questions out there because we're partners in moving healthcare forward. But the thoughts that were going through my mind as she described the experience and you described the experience was that there's a component of the cost of healthcare that usually doesn't get calculated in, and that's the patient or the member's time. And you mentioned going to the pharmacy and not being able to afford what has been prescribed, but when there's a pause with that, a good pharmacist also says, well, here's an alternative, but I'll have to go back to your physician to get an authorization to change the prescription or something like that. And two things happen. Number one, the trust level and the aspect of transparency diminishes in the eyes of the consumer. And in addition, the delays are just, they don't build the type of experience. When you described just a minute ago what was shared, it really sounds like it's even better than Amazon Prime. You don't have to wait for the shipment. You have all the information there. You look at it together with the expert, and you choose what works, and you go on. It really does focus on number two as well, which is the consumer experience and the consumer journey. And really appreciate you sharing that with us. I also participated last year at HIMSS in the innovation lab. Surescripts was involved with a prior authorization demo, and perhaps you could comment on how this really can accelerate, or how you can accelerate prior authorizations as well in that whole process.
Sure. So, and we would have shown it again this year at the Interoperability Showcase. But what we can do today and how we're helping physicians across the country is today there's a couple steps that we help with the prior authorization process for medications. The first thing we do is back at that real-time prescription benefit tool, when that physician is prescribing a medication, if they prescribe something that requires a prior authorization, many times they're seeing alternatives that don't require a prior auth. So they're able to change the course of their therapy and are able to avoid the prior auth altogether. They're also to see additional information at that point of prescribing around things like step therapy. So instead of maybe doing, or quantity limits. So instead of doing maybe 30 tablets and requiring a prior auth, they could do 15 tablets and avoid it. So that's first a big time savings, is just avoiding the prior auth altogether. But as you know, many medications still do require that prior authorization. And so what happens next in the workflow is within the EHR, those prior authorizations can be completed. So what happens is, working with our partners in the Surescripts Network Alliance, they will return to us the specific questions that are required for the medications. Those questions are put in the EHR. It automatically populates all the patient demographic and insurance information. Then they answer the additional clinical questions that are asked. And many times, and a significant percentage of the time, after they submit that information, they're getting a prior authorization approval in a matter of minutes. So instead of the sort of old process where a patient shows up at the pharmacy, the pharmacist says, you know what, this requires a prior auth, come back while I wait for approval. These prior auths are now being completed and approved in almost real time. So as a patient leaves the office and goes to the pharmacy, that medication's there waiting for them. Again, we're excited about that. We also had another virtual session that will be available for review, where we had Daya Saleh, who's a pharmacist of Advocate Aurora Health, talk about how they incorporated that into their organization. They're seeing tremendous improvement on reducing clinic and staff overtime.
Love it, and I really appreciate you sharing those examples of the consumer journey and the interoperability and the way the data can be shared to enhance the experience for the physician, for the patient, and for the health plan in terms of the efficiency that's shown there. So as we come towards the end of this, and we didn't want it to be too long, you and the audience see the top 10 in front of you. Is there a critical challenge that you see beyond that HCEG top 10 that should be keeping healthcare executives awake at night?
Sure. I mean, so as of today, there's obviously a lot going on with the coronavirus. But I will say another important area that we're hearing about across the country is specialty medications. Specialty medications today represent only about 1 to 2% of total prescriptions, yet represent about a third and growing portion of the total cost of medications for this country. And it's not only the cost of the specialty prescriptions, but it's also the process of starting patients on those. There's often delays in getting the additional set of information that pharmacies need to fill that medication quickly and safely and effectively. So we have a new service, and we're seeing some great results where specialty pharmacies now have a communication tool to be able to obtain clinical information from the providers, essentially on demand. And what we're seeing is reducing phone calls back to the provider's office for additional information and clarification. And what that reduction of phone calls is not just the sort of administrative burden of those phone calls, but it's also delays. And we're hearing from our pharmacies that those phone calls can cut back hours and hours of wait time, of waiting and delays that it takes to get that medication dispensed. So in addition to the tools like the prescription benefit to make sure patients are choosing the most cost-effective drug with their providers, in addition to the prior auth, so those can be approved, since many specialty medications do require prior authorizations, we now have this communication tool which helps connect all the stakeholders, all the network members in a specialty medication process, with a big focus on shortening the time to dispensing, which now we know can take days or even weeks, as well as reducing the phone calls and the back and forth, which are just, time consuming and frustrating for everyone involved. So I think every health system is thinking about that and the cost of those, whether it's for their employees, whether they have a value-based care program, or for their own personal needs if they need to be on one of those medications.
And if they're not thinking about it, they definitely should. I think as we close, you and I both have sort of referenced the material on the next slide, which is places that those on the program today can go and get more information, see the case studies that you've mentioned, and connect with you at Surescripts. We appreciate your insights, and thank you, Dr. Mellon and the Surescripts team, for jumping on this virtual HIMSS discussion so quickly this week. It would have been better had we been together, but we're not, so we're going to do fine with that. In closing, HCEG's mission is to guide healthcare executives through innovation, change, and growth. And we will continue these discussions and others, primarily digitally, given what's going on that you referenced, the coronavirus and other issues, throughout the next coming months. But the premier opportunity for networking with fellow executives from around the country on the HCEG Top 10 and helping set the list for the next year is our 32nd annual forum, which currently is planned for September 21st through 23rd in Boston. It'll be either in person or virtually, depending on where the coronavirus is at between now and then. We're not sure which way, but at the moment, plan to come. We can get you more information at hceg.org/Boston. or email us at info@hceg.org. And in either case, virtually or in person, we can promise you that we'll have great discussions there. Also, be sure to check out our website for the results of a National Industry Pulse survey that we just released. Has a lot more detail about those HCEG Top 10 issues. And finally, continue today's discussion via both the HCEG and Surescripts LinkedIn and Twitter handles that you see here, and register for the HCEG newsletter. It goes out every couple or 3 weeks and contains links to conversations like these and a lot of other white papers and blogs and discussions around the top 10 issues in healthcare. Thank you again, Dr. Mellon, and your team, and for you on the call, enjoy the rest of your day. Thanks. Take care.